morning. My name is Melanie Castaneda. I am the nurse that will be helping with your surgery today. I noticed that you said you grew up close to the beach, which actually it had always been my dream to live by close to the beach, which that's great. I mean, close to the ocean, being able to swim every day, not having to drive because you're so close. Okay, so let's talk about the procedure today that you will be getting performed. I will be able to answer some concerns that you have today and also be able to let you ask me some questions, see what your concerns are for the surgery. So, the surgery that you're getting today will be removing skin cancer that has shown up on the left side of your cheek. The goal today is to remove all of the tumor that is on your skin due to that cancer and leave the least scarring possible on your cheek. The type of cancer that you have is called basal cell carcinoma. So this cancer looks like a rash, like a red patch on your skin. It is caused by overexposure to the sun, which might be the case for you since you said you live close to the beach. So the doctor that would be performing your surgery today would be our skin cancer dermatologist, Dr. Albaran, will perform the Mohs surgery on you. The Mohs surgery is the most effective surgeries at removing this type of cancer, which is a good thing. The procedure is fast and easy. It takes about 2 to 3 hours for the procedure to be performed, and this is all through the time span of you coming in and then leaving. So it takes 2 to 3 hours, and that's during that whole time your tumor of the skin cancer will be removed and stitching will be done and all that fun stuff. So the first thing that would be happening during your procedure would be that Dr. Albaran would come in, numb that area where the skin cancer is, so that you don't feel any pain throughout the procedure, because it is a procedure where you're awake the whole time. And he will be going in with the little knife to cut the top layer of the tumor, and then sending that top layer to go to the microscope so he can go in, look at it if he got all of it or there's more of the tumor deeper down your skin. So while that's happening, he's gonna close up your wound, and you will just be sitting down waiting in the room the whole time, and it doesn't take that long. And then once he goes in, he cuts up the skin and looks at it and makes sure everything's good. He's gonna come back in. If there is more of the tumor deep inside, he would go in and remove it. If not, he would just go in and stitch it all up, and it'll be ready to go, which it's good. It'll be fast and easy. You don't have to worry about it. Like I said, it takes 2 to 3 hours. So once all of that is done, you'll be stitched up on your cheek. The concerns that you may have is how would it close up when I'm like the cleaning and all that. So you would need to just not mess with it. Most people do experience some itchiness, some redness, some bleeding, which is normal because the skin is getting used to it. It's just closing up. So if there is any infection that there might be, or if you have any symptoms of extreme pain or anything like that, just make sure you come in and let us know, or call us if you have any of those symptoms, because they could be dangerous. So just make sure you try not to wear makeup, try to keep the skin as clear as possible, that you can, for it to be able to breathe and be able to clear itself and be able to recover successfully. So you also may be able to go out on the sun, be able to go out and do all that stuff. Just make sure you do wear a hat and you could wear some sunscreen to protect your skin from the sun. Just make sure you keep the skin really protected, and just if you don't want to go out and all that, we recommend that for you just to be at home. Don't lift anything, don't put any strain on your skin. Like, just take it easy, and it'll be able to give you a fast and easy recovery. Just like I said, if you experience any pain, any extreme bleeding, anything like that, just make sure you give us a call. If anything, just call us with any concerns, and we'll be able to help you. Also, if you experience all those things, just make sure you go to the nearest hospital to get it all checked out. Okay, so I also wanted to see when you will be able to come in for the next for you to take your stitches out. So that would be around, I recommend for you to come in around 14 days after today. So it'll be fast and easy for you. It's just whatever you feel comfortable with, whatever time you feel comfortable with and doing, and we will get everything done and just make sure everything's nice and cleared up. Anything happened, you don't have any infections, and everything looks good. Okay, thank you.